We often see patients who present with both migraine headaches and dizziness. It's quite common that when there's an issue at the upper cervical spine, things can get really complicated and symptoms can get quite extreme. So when migraine headache patients present to our office, it's normal that they've been everywhere, had every exam and had every test, and still are not getting answers. When we do our thorough exam and we go through our different testing with thermography and x-rays and digital range of motion and other tests, we often find that there's an underlying mechanical or issue in the way that the upper cervical spine is moving and the impact that's having on the body. So what we found is that when you address that upper cervical area, correct the mechanical issues and the nervous system issues related to it, the body then begins to self-heal from within, and often the results are amazing. Patients who come with migraine headaches and often have blurry vision, those typically have the blurry vision prior to the onset of the migraine, although the two can come in any pattern and still be connected. An upper cervical evaluation is unique. For many patients who come with blurry vision along with their migraine headaches, they've been to the optometrist, they've been to their primary, and countless other healthcare providers. So as an upper cervical chiropractor, my job is to focus in on the upper cervical spine, to take x-rays, to use thermography to look at the nervous system and the neurophysiology of the body, to take digital range of motion tests to see exactly what's happening there and to see if there's an underlying issue. Because if there is a good chance that by correcting it, the body can begin to heal better than it has so far. When patients come in and they have migraine headaches and blurred vision, they often think that it's going to be very unique and isolated to that kind of a symptom, but it's not. Inside of upper cervical chiropractic care, there's a protocol that we follow for all of our patients. The length and duration can vary based on symptoms, but the basic steps of our protocol are the same. Care always begins with that first visit, where we go through a very detailed history from injuries and other things that may have impacted this. We talk about even things like your job and your hobbies and things that you've done in life that may contribute. We go through and do different testing, such as digital range of motion, paraspinal infrared thermography, and very specific x-rays that are taken to show the mechanics of the upper cervical spine. At the end of that visit, we're able to see what's happening and what needs to be done to address it. From then on, it's all about following the protocol. Regular visits to make sure that the body is going the right direction, healing, and adjustments when necessary. Always aiming to do as few adjustments as possible and get the best results. When patients come in with both migraines and those vision or visual disturbances, and we talk about timelines, usually migraine patients have known that there's been something wrong for a long time. It's fairly unusual that they come in with this being a brand new onset. So those patients realize that it took them quite a long time to get where they're at today. So I always like to point out to people that it took you a while to get here, far longer than you've actually had symptoms. And it can take you a long time to get well. But long time is relative. A lot of patients have a lot of improvements in 6 months, some even less. So if it takes you a year to get there, it's a year that is well worth it. You could be one of the lucky ones that it takes only a few months to start to see changes. But it's important to know that it's not a quick fix. It's not a one-time thing. When you're asking the body to heal from within, my job is just to be an aid and a guide and to correct things when necessary. Your body is amazing and magical and it does wonderful things, but it does need time. And then it's important, I always point out to patients that they need to know that sometimes you won't even realize how much progress you've made. And if you're laughing right now, you're just like everybody else. Everybody thinks when I've lived at an 8, 9, or 10, 5 or 6 days a week for the last several years, I would absolutely notice if it reduced. And I can tell you from 30 years of experience in helping people like this, you don't. As soon as the threshold drops and as soon as you drop down, your recalibration or your threshold will reset itself. I've had countless conversations with patients over the years who would say things like, I don't know if I'm getting better. And when we go back and look at their notes, all of their numbers have dropped by at least 50%. So just know that it is a process, but you're worth it. Okay, so without naming names, and I could probably throw a lot of names in here, when you talk about migraine headaches going away, and the blurry vision that comes with it for many people, and upper cervical chiropractic care, I have one story that I think stands out. It's a patient of mine who I knew her name before she ever came in because so many people referred her. She was one of those classic been everywhere, done everything, and just wasn't getting results, but she was willing to keep trying. When she came to see me, she was skeptical like everyone else. After her first adjustment, she went home and came back for her follow-up visit, bringing her best friend in tow. She'd had such substantial changes from one adjustment that when she told her best friend, who also had migraine headaches, her best friend tagged along and said, "You need to sign me up and you need to start like right now." And so over a decade later, they're both still my wonderful patients on regular wellness care, and they're both still raving fans. But I'm fans of them as well because they never gave up hope, they kept trying, and they knew they were worth it. And in the end, the possibilities just grew and grew for both of them. There's a lot I wish people knew about the connection between your neck, your health, things like migraines, vision, and many, many other things. Quite frankly, almost everything. Your body is amazing, and you want to pour into it with wellness care and take care of it from the inside out. The upper cervical spine can have issues that can be created by different traumas, whether they're repetitive things from sports or work or car accidents and larger injuries. And if you detect and correct these issues early on, the body heals amazingly and is able to do quite a lot. So whether things have gotten extreme and are chronic or whether they're brand new, upper cervical chiropractic should be part of your plan in trying to get well so that you get the best results.